All right, Dr. Bolson,
All right.
the floor is yours.
I do have a couple things I want to say today. Let me start with non-coronavirus stuff first. One thing I am excited about, last week, we had our first North Star Parent Advisory meeting, which was it was a very rich discussion, also very informative. Because we know we have so much more to do, not just in terms of answering questions about the work we're trying to do with North Star, but also in ensuring we can communicate well with particularly our parents and making sure we have the information they need. So I very much appreciate the participation. We have a small but very active group, and I can say that the conversation was very wide-ranging, but I think some of the biggest work is around in the area of equity and how we keep looking at things in our curriculum, in our opportunities for students, how we work with some populations that really need more support from us. And so just so much there. I was very excited about that, and we expect to be meeting with that group regularly. We did have another gratitude tour to Highway to Grace last week. Also, fantastic opportunity to see all the schools in the Highway to Grace community, and they were very welcoming, as they always are. So it was nice to be able to attend that. And so I will, at this point, switch over to coronavirus, or COVID-19. I had the opportunity to listen to the governor's press conference today, because the information is just changing by the moment. And one of the things he announced is that he is convening a state-level task force, and he named a lot of the folks in the task force. We, of course, have a local task force that has been meeting for a little while now. We were working to get our plans done ahead of this, and of course, being only the second county in Harford County and in the state of Maryland to have a confirmed case, we jumped up the line a lot more quickly than we had hoped. But that said, we've been pretty busy. In addition to the work we had done prior to yesterday, a lot's happened since yesterday. We did have a call with all of our principals this morning because we had begun seeing concerns coming in on social media already, but when the confirmed case was announced yesterday for Harford County, two big areas. I mean, we've had a number of messages come in, a lot of calls into our nursing staff today, but two big issues that we were looking at were a lot of concerns about hand washing practices in schools and how often students have the opportunity to thoroughly wash their hands. And the other was around some of our attendance practices, and I'll give a little context for that in a moment. We did speak, as I said, with principals this morning. We have asked them to be very deliberately focused on the opportunities they provide for students to wash their hands, that is very much a priority. They're doing the announcements in the schools, giving instruction about how best to wash hands, but also that they're communicating with their communities about how students are getting those opportunities, because that has been a concern, and we've seen a lot of that in social media. The other was attendance. And I just want to put this in context for a moment, because starting about a little over a year ago, there was a report, it was a national level analysis that identified Maryland as one of the states with some of the worst rates of chronic absenteeism in the country. State Board of Education, even at the legislative level, there's been a lot of discussion about attendance, and school districts have been in a position to really ramp up their practices to ensure everyone understands that they need to be in school. Some of that had to do with letters we send, but other practices, we've had things like 100% perfect attendance awards and things like that. The trouble is, our health officials have always had concerns with those types of efforts, because if we do things to incentivize students to come to school even when they're not healthy, because they want to get that certificate, they want to get that recognition. So it kind of puts us in a funny place, because on the one hand, so at this point, particularly because of the circumstances we're dealing with, it is still the expectation that our students who are healthy are in school. Our students who are sick should not be coming to school. If you have a fever of 100 or more, and that's the threshold we look at for attendance. If you have a fever of 100 or more, whether you're a parent who might be visiting a school, whether you're a staff member who works in a school, or a student who attends that school, we don't want anyone with fevers who are sick coming into our schools. And our basic guidance around that has been, it's okay to return when you have been fever-free for at least 24 hours, but even better when you've had some guidance from your healthcare provider, notably your doctor. So that's really the guidance we've given around attendance, but reinforcing that at this point, we have no plans to close schools or cancel major events. There is, of course, I mean, anyone looking at the news can see there's a big dialogue going around this, the relative benefits of closing versus staying open, particularly the impact on communities who may not have the resources for accessing food. We have many students we feed on a regular basis, whose parents may be in a position to supervise their children for any type of absenteeism or any type of closure. So we really have those that's being weighed against all of the issues at play here. We're taking significant guidance, notably from the health department, the local health department, but of course they're working closely with the state health department. And in all cases, we're deferring to the guidance provided for the Centers for Disease Control and Prevention. And in fact, I would point anyone to their website. They have great school guidance on there, and that is really the authority we go back to, because we know there's lots of ideas, opinions, sources of information out there, but if you can stick to those local health department, state health department, and CDC, I think those are really the best authorities at this point for us to be referencing. Let me see what I've missed. I think that covers most of it. Just to say, as we know, this is an evolving situation, and it's very important to us that we're working closely. We've had tremendous collaboration locally. We have more community-wide efforts tomorrow to collaborate with the other leaders of all the major entities in town, and that will be ongoing. We'll continue to be in touch with our schools if anything changes, because, as I said, things are changing daily. And so we just encourage everyone, be safe, use good judgment. We want our students in school if they're healthy. We want them to stay home if they're sick. And with that, I say thank you very much for coming tonight, and I will see you soon.
Alrighty. Ms. Schmidt, can you review our upcoming meetings?
Next meetings will be March 23rd and April 7th, both at 6:30 p.m. here in the Roberti Building.
All right, with that, have a lovely evening. We're adjourned.